everyone. I'm talking about POMH UK Audit, which is the prescribing of regulatory mental health audit conducted by the Royal College of Psychiatrists. The focus was around the use of Clozapine. It was a re-audit because the baseline had been done in 2018, so this was the 2021 audit. In terms of the standards, there are several standards we measure. So what POMH UK does is really a lot of clinical organizations, NHS trusts participate in this audit, and you can benchmark your results against other trusts. So you can see that from the results we got. So we had a treatment target. The treatment target was around how, if we do have conversations initially with the patients and the carers about the benefits of Clozapine before we initiate it and the possible side effects. Now, that doesn't meet what we call a standard, because in some situations we might not necessarily be able to meet that. But in terms of that, we do quite well with it. So we do have that conversation when we can. Moving on to the standards, the things I want to draw your attention to are just the areas. There were a lot of good practice areas, or where we found that we might need to work a lot more on in areas where we need to get results. So in terms of doing assessments, whether pre-starting Clozapine or monitoring it. Later on, it's around blood tests, so things like lipids and glucose levels were usually monitored. Also, the other thing we found out was that in terms of the data, we have about 500 patients on Clozapine, but we didn't get a lot of audits. We've got, in some cases, we had less than 20 patients being audited, so it's not the true representations in terms of some standards, but it was still good information in that it helped us to identify that there were gaps in our policy, for example, which we have strengthened now. We are also hoping to re-audit soon and participate in the next POMH UK service, so hopefully see improvement in different areas there. The other thing to mention was that we found out that engagement from teams was also reduced, that if we do get better engagement, which we hope to promote by sharing all the results of this, we would improve the numbers and hopefully get a true picture. Thank you.